Hello and welcome back to our channel. Today we are going to be looking at a very important topic, herpes. This topic is mostly stigmatized but really important to be discussed. So in this video, we're going to be looking at the causes of herpes, the signs and symptoms of herpes, how you can know you have herpes or how you will know somebody have herpes, the prevention of herpes, and as well the treatment option for herpes. So please do well to watch this video to the end so you can get all the information I have for you about this particular topic, herpes. Now let's get started with what causes herpes and what is herpes. This is one of the major questions that a lot of people keep asking. They have been hearing herpes but they don't even know what is herpes. And sometimes most of them might be having the signs and symptoms of herpes but they don't even know it's herpes because they are not aware of how herpes look like. So you don't need to worry if you're that kind of person because I'll be explaining all of that in this video. Now, herpes is a viral disease that is caused by the Herpes Simplex Virus, the HSV. And we have two major strains of HSV, the HSV1 and the HSV2. Now, HSV1 is mostly linked to herpes symptoms that appears on the mouth, while HSV2 is mostly linked to herpes symptoms that appears on the genital areas. So as a person, if you're having herpes symptoms on your mouth, you should know it is HSV1. And if you're having herpes symptoms that appears on the genital area, you should know it's coming from HSV2. Now, there are different signs and symptoms of herpes. There are different ways in which herpes presents itself in the body. When you are having this particular infection, you will see this sign and symptoms that will show you are having herpes infection. And one of the major signs and symptoms that this particular infection will always present with when it's in your body is painful blisters and painful sore. So as a man or as a woman, if you're always experiencing sores around your mouth, around the genital areas, then you should know you might be having herpes. You might also experience pains while urinating as a man or as a woman. Or sometimes you might even have difficulty in urinating. When you want to urinate, you have to force yourself before the urine comes out. This is also linked to herpes. You might also experience some kind of itchy sensation around those blisters. When you are having blisters around your mouth, you might also be feeling some kind of itchy sensation around there. Around the genital areas, you might be feeling like just itching the place. This is mostly linked to herpes. You might also experience some kind of flu-like symptoms like fever, swelling of your lymph node. This is mostly caused by herpes. And if you're having any of these signs and symptoms I've just explained, please do well to visit a healthcare provider so you can treat yourself before it destroys your body system. And just for your notice, this infection goes and come back all of a sudden. So as a person, if you're always experiencing some kind of blisters that comes after 1 month or after 2 months, after 3 months, it goes away and come back again after a while, then you should know you might be having herpes and you need to also treat it as soon as possible. Now, it is very important you know that this particular infection is sexually transmitted. And because it is sexually transmitted, you can prevent this particular infection by practicing safe sex. Practicing safe sex in the sense that you can use condom to prevent yourself from having this infection. You can also use dental dams in terms of oral sex. And you should also avoid sharing personal belongings like towel, spoons and other utensils like that that can promote the transmission of this particular infection. And you should also make sure you're always testing yourself for STIs regularly, at least twice a year, so you can make sure you don't have this particular infection in your body, because when this infection gets into your body, it's not curable, but it can be managed. And that's why I'll be recommending to you 3 major medications that is mostly used in managing herpes. And one of the medication is an antiviral medication, which is used in reducing the viral load of this particular infection. An example of antiviral medication that is mostly used to manage herpes is acyclovir and valacyclovir. These 2 medications can reduce the viral load of herpes in your body. You might also need to use some kind of topical ointment or topical cream to reduce the pain and inflammation around that area. And one of the cream and ointment I will recommend to you is docosanol and lidocaine. These 2 creams are very effective when it comes to reducing inflammation and pains around the site of blisters caused by herpes. You might also need pain reliefs like ibuprofen, diclofenac, and acetaminophen to reduce pain either while urinating, to reduce pain at the point of blisters either at your mouth or at your genital areas. These medications are very effective when it comes to reducing pain. So after watching this video, if you find it very helpful, please do well to subscribe to our channel. Also share this video to as many people as you can. You might be saving the life of somebody. Thank you for watching this video. I will see you next time.